Welcome to my final exam by Christopher Ashcraft for the class EDTR 261. The essential question we are focusing on is to describe the process of assessment in each of the following areas: intelligence, academic performance, language, perceptual functioning, behavior, physical development, and social emotional functioning. In special education assessment, special education is a team-based problem-solving approach to gather data to determine if a child is eligible for special education services. Intelligence assessments have the ability to measure the ability to reason, think abstractly, solve problems, and use cognitive processes. They can show a child's intellectual potential and predict or estimate academic success. They are administered by the school psychologist or other diagnostician. Some of the assessments used to measure for intelligence include the WISC, Stanford-Binet Intelligence Scale, and the Differential Abilities Scale. Some academic performance assessments are intended to be standardized and measure progress. They test reading, phonics, written language, spelling, and mathematics. It's gathered by an evaluation of work samples, measures specific strengths and weaknesses. Scores are typically compared to others of the same age. It's administered by the special education teacher. Some examples of assessments used for academic performance include the Woodcock-Johnson Tests of Achievement, the Wechsler Individual Achievement Test, the Wide Range Achievement Test, Kaufman Tests of Educational Achievement. Language assessments are meant to test receptive and expressive language skills, language pragmatics, and articulation. They measure the ability to understand spoken language and convey ideas without verbal cues, and they interpret social situations. It's administered by the school's speech-language pathologist. Some examples of assessments used include the Peabody Picture Vocabulary Test, the Clinical Evaluation of Language Fundamentals, and the Test of Language Development. Perceptual functioning assessments typically involve copying figures or shapes, finding matching or identical patterns. It can measure spatial relationships, visual memory, visual sequencing, visual closure, visual discrimination, and figure ground. These are typically administered by an occupational therapist. Some of the assessments used to gather perceptual functioning include the Peabody Developmental Motor Scale, the Developmental Test of Visual Motor Integration, the Bender-Gestalt Test, Preschool Visual Motor Integration Assessment. Behavioral assessments are conducted to assess how the parents and teachers see the student. These can provide information about the student's behavior compared to others in the same age range. These typically are rating scales which use T-scores to report data. They are usually completed by all teachers who work with the student across multiple disciplines as well as parent input. Some of the assessments used for behavioral are the DeVroe Student Strengths Assessment, the Child Behavior Checklist, and the Social Skills Rating System. There are also physical development assessments. These help measure the level of a child's developmental growth in motor skills, language skills, concepts, and self-help skills. These are frequently used to identify and diagnose a developmental delay in young children. School psychologists, doctors, and other diagnosticians can administer standardized psychometric assessments, while also observations done in structured and unstructured settings. Some of the assessments used for physical development include the Denver Developmental Screening Test, developmental indicators for assessment of learning, the Brigance Early Childhood Screening, and the Brigance Inventory of Early Development. Social emotional functioning assessments help to measure self-awareness, self-management, social awareness, relationship skills, responsible decision-making in different environments. The rating scales collect feedback from parents and teachers, and the data is compared. School psychologists can also administer these assessments. Common assessments used for social emotional functioning include the DeVroe Early Childhood Assessment, the Social Emotional Assist and Resilience Scale, the Vineland Adaptive Behavior Scale, and the Connors Parent and Teachers Rating Scales. Please take a moment to view our references.